Madam, I commend the Ministry for its efforts to reduce the smoking prevalence through its multi-pronged approach, which includes the banning of tobacco product sales to minors and the I Quit 28-day countdown. Unfortunately, smoking continues to be a significant contributor to the disease burden in Singapore. We are familiar with the diseases suffered by smokers and those exposed to second-hand smoke. Recent research has highlighted the dangers of third-hand smoke. Third-hand smoke clings to the hair, clothes, and any surface in the vicinity long after smoking has stopped. The residual nicotine and chemicals build up on surfaces over time and resist normal cleaning, posing a potential health hazard to anyone exposed to them, especially children. Would MOH implement more stringent measures to combat the hazards of third-hand smoke? Thank you.
As we move beyond healthcare to health, we need to do more to tackle factors that contribute to ill health and diseases. Tobacco use is one such major contributor in Singapore. HPB has a program called I Quit that supports smokers to quit. It will extend the program's outreach through roadshows at various community and workplace settings this year. We want to protect our young from the harms of tobacco and lay the foundations for good health. In Singapore, nearly half or 45% of smokers become regular smokers between the ages of 18 and 21 years. According to a report by the World Health Organization, persons who do not start smoking before the age of 21 are unlikely to ever begin. Findings from Needham, Massachusetts, the first US town to increase its minimum legal age for sale of tobacco from 18 to 21 years, are promising. Youth smoking rates have fallen more rapidly here compared to neighboring areas. At least 215 localities in the US, including New York City and the states of Hawaii and California, have since increased their MLA to 21 years. Between December 2015 to March 2016, HPB conducted public consultation on further tobacco control measures. The feedback showed considerable support for raising the MLA in Singapore. MOH will take further steps to reduce, if not eliminate, the opportunities for our young to be tempted and to take up smoking before 21. We will propose legislative changes to Parliament within a year to raise the minimum legal age for sale of tobacco products to minors from 18 to 21 years. The change will be phased in over a few years. We are taking steps towards standardizing tobacco packaging. Australia, France, and the UK have all implemented standardized packaging. We have closely studied the experience of these countries and see significant value in moving in this direction so as to reduce the appeal of tobacco products, particularly to youth, and raise the visibility and effectiveness of health warnings. We will conduct a further public consultation on standardized packaging this year to seek additional and more detailed views on possible standardized packaging measures. We will carefully review relevant considerations, including public health, intellectual property, and international law perspectives, and ensure that any measures taken are consistent with our domestic law and international obligations. We will continue to monitor international best practices in tobacco control and will adopt appropriate measures to control tobacco use.